Hi guys, James Laughlin here with Kinetic Edge Physical Therapy at our Des Moines location. We thought we'd introduce to you the different types of techniques for soft tissue massage today, specifically using something called Astym. Astym is a tool-assisted soft tissue massage geared towards working with injuries from people that have maybe got scar tissue following a surgery, maybe somebody has tendonitis of the knee, the elbow, plantar fascia, the Achilles tendon, all these areas that people kind of have these chronic aches and pains, as well as treating overuse type injuries. So people like an athlete or someone who has a job that has a lot of repetitive movements and maybe they're starting to notice some aches and pains. So the Astym tools are found inside of our box here. So when you come into the clinic and you see me opening this up or you hear the sound of the zipper, you'll know that we're going to be starting an Astym treatment with you. Inside of the box, we have a few things in there. We have tongue depressors, and we have some type of a lubricant that we're going to use on your skin so that we decrease the friction to the skin, and something that's called petechia, or the little red bruising that you might see. Inside the box you'll find the tools that we have. The first tool that we have is what's called the Evaluator. And so part of Astym is that we're going to have different tools that allow me to not only analyze and evaluate your tissue quality, but also to affect some type of change on it so that your body does start to make the changes to improve your symptoms. So the Evaluator is a broader shaped tool that we use primarily to introduce the concept of a soft tissue massage to your body. So I'll be using the same pressure, but it won't go nearly as deep as some of the next tools that we'll introduce. Okay. The next tool that we're looking at is called the Localizer. And the Localizer, as you can see, has a more beveled edge. It's a little bit more rounded and it's not quite as broad. So because it has less surface area to it, it's going to penetrate a little bit deeper into the tissue. This is where we're going to really start to affect some change onto the tendon itself. And then last but not least, we have what's known as the isolator. And the isolator is really the deepest. You can see that again, it still has that beveled edge, but it is much smaller than the rounded edge that we had on the Localizer. And this one is the one that's going to really stimulate the greatest amount of change on the tissue. What's nice about it from my application standpoint is I don't have to change the pressure in order to get deeper into your tissues. Whereas if we were to use other types of instruments, you may notice that the therapist is working much harder in order to try to penetrate into that tissue. And that actually usually leads to a lot of bruising and a lot of uncomfortableness. So if you're interested in learning more about soft tissue mobilization and the Astym treatment, or if you're wondering if it's an appropriate strategy for helping you with dealing with your injuries, feel free to give us a call at 866-588-0230, or you can check us out online at kineticedgept.com.